cancer is the most common cancer among Americans except for what? It comes in second. Do you know what it's behind? What would you guess? You had to guess what was first. What? Skin cancer is number one. Why do you think that is? Yeah.
Because we strive to get
Obviously, the sun and tanning beds, you know, that kind of thing are very popular. So, how many women do we have in here? Okay, the statistics show that 1 out of 8 women will develop breast cancer. So that's about 2 in here that are very likely to develop breast cancer. Okay? Does anybody know anybody who has breast cancer? Who has had breast cancer and a survivor? Okay. Not everybody's that lucky to be a survivor, but with what we're going to talk about today, we can be. Okay. Every year, or as of this year, I should say, 232,670 women will be told that they have breast cancer. That's a huge number. But it's a type of cancer that's not invasive. So it's something that can be treated. Why do you think that is? And we've come a long way with what we know about breast cancer, prevention, but because of the education that you ladies are getting, mammograms, teaching women how to do a self-breast exam, so they're being caught earlier stages. So if you catch something early, you're more likely to be cured of it, okay? Common sense. 40,000, though, will die from breast cancer. It could be putting off a mammogram, not ever doing a self-breast exam. You know, there's reasons, for not getting the help or just simply, choosing not to do it. And we make a lot of choices, and some people just choose not to get the health care that they deserve to give themselves. All right? Now, among deaths, we talked about skin cancer is the number one cancer, followed by breast cancer. But as far as somebody dying from cancer, does anybody know what the number one cause is? Not breast cancer. Anybody can take a guess on what the number one death of cancer? Lung cancer. Okay? Not all women that get lung cancer smoke. Okay? Sometimes it could be work-related. I know a girl who had lung cancer, she was in a safe environment. She never smoked, and she died in her 30s. So, we're going to talk about some things you can change in your life. You have those choices. Some things you can't change, and sometimes no matter what you do, you just happen to be a target, okay? Now, we talked about the number of cases over the years have gone up, but the death rates have drastically gone down, okay, because of education. There's a lot of it. There are more than 2.8 million breast cancer survivors in the United States. And a lot of people that walk for your Relay for Life, a lot of those are breast cancer. Now, what about men? Did you know that men can get breast cancer too? About 2,000 men in a year's time are diagnosed with breast cancer. They have breast tissue also. Okay, so we don't usually think about that, but it is. Okay, what are some risk factors that you have no control over that could possibly lead to breast cancer? No control over whatsoever. Can you guess any?
Heredity.
Okay, could be heredity. Okay. As you get older, can we help if we get older? There's an alternative to not being here, but we can't help that each year we have a birthday and we celebrate that when we get older. So the older you get, like your risk now at this age is not very high, but as you get older, your risk goes up. Okay. African American women have a higher rate of breast cancer. I don't know why that is. You can't change that. Okay, that's something you can't change. Women in general have a higher risk as compared to men. And your genetic makeup. Now, you can change your genes every day, right? Put on your favorite pair of jeans. There's nothing like putting on your favorite pair of jeans, but you can't change your genes on the inside. And some women have a gene that can predispose them to cancer. And you can actually have that. It's about a $5,000 test, but you can, it's kind of like, do I want to know that? Or do I not want to know that? Some women want to know, and they can seek aggressive. I know I've heard stories of some women who found out they had that gene. they had a hysterectomy, they had both their breasts removed. So that's very extreme. But, you know, I don't know what I would do. If you're in that situation, you don't know what you do. I personally, both of my mom has two sisters. Both of her sister's oldest daughter have had breast cancer. So where does that put me? Could greatly increase my risk, right? So knowing that, I should be proactive in making sure I do what I need to do to make sure I'm protected. Okay? Doing self-breast exam. When I turn 40, getting a mammogram. Okay? And I heard all these horror stories about mammograms. It's not bad. You know, y'all got a long way to go. The neat thing about breast cancer awareness is the NFL and our local ACEs Friday night, they're going to be supporting us, you know, wearing their pink, and that's awesome. Because that causes, you know, it gets women's attention. It gets men, you know, hopefully talking to their girlfriends or their wives, you know, spreading the word. You know, you need to get checked out. So that's a good thing. Let's see. Also, if you have breast cancer in your family, you should tell your doctor. A lot of times a doctor will have you get a mammogram earlier. You know, usually the baseline you start at age 40, but if you know it's in your family, then you should definitely get it earlier, just to make sure. Now, does the mammogram catch everything? Does doing a self-breast exam catch everything? It's also important when you start getting your physicals at your doctor's office, they'll do what's called a clinical breast exam. Some people are so scared that they're not doing it right, they don't do it, okay? We recommend that you do it the same time after your menstrual cycle, usually every month. And then after you've had a clinical exam, you should go home and just kind of feel what they feel. Because they can change all during the month. Caffeine, if you take in a lot of Mountain Dews or tea, that can actually cause your breast tissue to feel different. Different times of the month, they're tender, they're sore. So there's, you need to know what yours feel like so that you'll know exactly if you find a change, you'll know. You know, you'll be suspicious of it. Okay? Now, what are some risk factors that you do have control over? We talked about the ones that you can't change. What are some ones you can change that could relate not just to breast cancer, but all kinds of cancers? Y'all know this. This is not hard. I know you don't want to think right now, but just think about a few. What can you change in your life? What do they stress when they show you a plate? What should your plate look like? Should it all be rice and baked chicken? Should it all be one color? Okay, adding color to your plate, as simple as that, a salad. So increasing your fruits and your vegetables can greatly decrease a lot of types of cancers. Not smoking. We know that smoking has a lot of side effects, not just with cancer, but with heart disease and other things. A healthy weight can help with all kinds of cancers. 30 minutes of exercise most days of the week, and it doesn't have to be getting out and, you know, climbing a hill or jogging or running as fast as you can. It can be anything, you know, something you enjoy. Okay. Environmental factors, sometimes work-related issues that you can't, you know, prevent. And then you can also let your boss know that, you know, this concerns you. So that's when you get older. Okay. Now, again, we talked about you may not have anything, you may not have a family history, you may not have anything that would predispose you, but some people just develop breast cancer, and it just happens, you know, it could be any kind of disease, but, you know, breast cancer could just be one that you had no kind of warning. Okay, what you're looking for is something, I've heard it described as an M&M or the tip of an eraser in your breast would give, you know, some kind of warning. But I'm going to show you, kind of demonstrate how to do one properly. And I also have one, I'm going to pass this one around first. And I want you to see, let's see how much sheet real quick. I think there's 5 in here. Okay, there's 5 in here, and I don't want you to pull off the back. After I pass it to this table, I actually have one that's clear that you'll be able to see where the lumps and bumps are. And you're actually going to be, this is breast tissue under here as well. And the sheet that I'll give you, Are they back there, the breast self exam ones? I'm not passing these out. It used to be that you went in a circle, and now they're saying that you'll see on your sheet that there's a grid that you're actually going to go up and down. It's just the way they found that more lumps have actually been discovered. Okay, so I'm going to start over here and just see if y'all can. And some of them are really hard to find, but see if you can find 5. All right, so we talked about it. What time of the month should you do your self-breast exam? Okay, about the same time. A good time to remember is after your cycle. Okay, they're not as tender. They're just more normal. So you can either lay down. Some people do it in the shower, but you actually want to look in the mirror. And I'm just thinking, like, this is weird. But you want to look for any kind of like dimpling or puckering or indentation, discharge from the nipple, anything that would be an indicator that this just doesn't look right. Something's not right with this. Okay. Basically, lay on the bed. You can just use the opposite hand that you have your arm back, and you're gonna, like I say, start under here. How many did you find? This is weird. It is a little weird. Now I'm going to show y'all this one, but don't pass it to this table until they're done. But this will help you to know more what they look like and what they feel like. That shows you where some of them are. And another thing y'all want to use, I forgot to mention, girls, you don't want to use the tips of your fingers. You want to use these 3 fingers, and you want to use the pads of your fingers. Okay? Your steel arm, and you... Oh, no, I'm not going to touch this. And you kind of want to do 3 levels of pressure. You want to go soft, a little harder, and then you actually want to kind of feel the bone beneath it. Okay? So you're going in a circle, but you're starting under your arm, and you're going to go up. You're going to start here, about a fingertip down. So you see the grid? Oh. See the grid? Look over here on the up here in the corner. That's the whole area that you want to cover. Did y'all get to see the top right? Yeah. Yeah.
Sarah.
Alright, so I want somebody to be able to find one for me. Did you? Okay. And these 3 fingers, you want to go in a circle, kind of light, and then down deep where you should be able to almost feel your bone. And you're going to go up and down the entire breast section. It's not easy to do. That's why we tell you, after someone else, a trained professional like your clinical breast exam, do one on yourself. But even now, and you're thinking, I'm way too early. And yeah, you probably are. You're way too young to, you probably get cancer. But you still need to get in the habit of knowing what they feel like, so you'll know if something's different, basically. Okay? Did you find one? And even under the nipple area, you can develop. And that's where men's usually develop, is under that area. Okay? So, we talked about self-breast exam, clinical breast exam, and mammogram. Okay, those 3 things that people are using and working with together, that's what's causing the number of breast cancer patients to really have early treatment and early success rate with being cured, is those 3 combination, those 3 things that you use all together, so that you're checking behind each other and making sure that nothing's missed. All right. True or false? You can get breast cancer even if it doesn't run in your family. We know that's true. Okay. More than 95% of no kind of history in their family. Okay, so very important to do self-breast exams, clinical self-exams, and mammograms. Okay, and you know, with all this attention with the NFL and our local ACEs helping out, this can help you, you know, making sure your sister, older sister, or your aunt, or your mom, you know, make sure they're doing these things. And that probably sounds weird to you. Mom, have you had your mammogram? You know, how many of us are going to do that? But, you know, just to get awareness out to make sure, because this is something that can be cured, can be, you know, gotten rid of, and hopefully won't develop if we do these things. We won't even get breast cancer. All right, if breast cancer runs in your family, you're sure to get it. We know that's not true. I mean, you can be, if you have a close relative, you can be more likely to get it, okay? Now, doing your self-breast exam, I had somebody to explain it this way the other day. If most of you, the lights were off, maybe you're sneaking in, maybe you were out too late or something, and you had to sneak in through your den or whatever to make it to your bedroom, most of you could do that with the lights out, right? You know it well enough that you could get in without getting caught. Now, my brother always ended up kicking a door, or, you know, we could never sneak in. It was always something with him. But anyway, now, what if, by some chance, your mom was fall cleaning the house, and she moved the furniture around, and she put maybe a plant right where you usually step, right before you step out of the bed, and it messes you all up. That's kind of like when you're doing a self-breast exam. When you're used to what they should feel like, and all of a sudden you feel something that's different, that's kind of how we want you to relate it. That's why you need to get used to what your breasts feel like. Okay, and everybody's different. Some have more fatty tissue, some are more dense, you know, so we're all different. Okay? You should still get mammograms after menopause. And this is after a woman stops having her cycle, of course, and the answer's true. And men can get breast cancer. We talked about this. About 2,000 men each year are diagnosed with breast cancer. Surgery and needle biopsies can cause breast cancer to spread. There's no proof to that. And when they find the lump, that's what they'll do, is usually take a needle and draw some of the fluid out, and they'll send it off for testing, and that'll tell them kind of what they need to do next. And there's nothing you can do to lower your breast cancer risk. Is that true or false? We talked about some of those things that you can actually change to hopefully make your numbers go down. Okay, very good. Y'all listen. Okay. Does anybody have any questions with the models that are sent around? Okay, basically, I know, you know, I hope y'all don't think this is not important, because it is. I hope y'all will take the time to take care of your bodies, make sure you're, you know, I know you're active at this point and eating good, but, you know, just taking care of yourself, because this is something that can, even if it's found, we want to find it early so that we can have a high success rate of not leading to an invasive type of cancer and other forms of treatment, you know, having to be taken. Does anybody have any close relatives with breast cancer? Like really close? Success? Call early? Okay, can y'all think of any questions?
I want to just say too that I've found cysts in my breast since I was 18 and went to my very first physical, and I've had to have the biopsies done, and I have a history of breast cancer in my family, and I actually have to start having mammograms at age 35. So I know y'all are young and you're like, I don't have to worry about this, but it can start at a young age too. So.
And I've actually felt like on the side right here a very hard spot, and I thought that it could have been like a lump or something. I went to go get checked out, but it turns out that I just have breast formation, so I can't drink that much caffeine.
Right, I have that problem. So it's very real, even though we always think it's not going to happen to us, but you know it can. So help us, just like the NFL, just like you know your ACEs are doing, help us to spread the word, and you can actually save somebody's life. Okay, just by don't put off a test that can be done that can save your life. Okay. Thanks. questions?
All right, thank you, Miss Wanda.
Thank you.